Hi guys, we have Linda here who came to me for her severe pain in her right knee. She had KL4 osteoarthritis in the medial compartment with complete loss of cartilage and bone on bone, and her medial meniscus was extruded and macerated. So we did bone marrow autologous stem cell therapy on her. Her meniscus was injected along with the joint, and also we did subchondral, femoral, and tibial condyles. Let's find out how she's doing. Linda, how's your pain now?
It's absolutely gone. It is wonderful.
It's been only 2 weeks since the procedure. Usually patients continue to get better, and in our experience, this has been a long-lasting effect. So Linda, you had knee replacement on your left knee, correct, about 10 years ago?
Yes, I did.
And why did you choose stem cells over knee replacement for your right knee?
The knee replacement was so painful and the recovery was so long that I could not think about having another knee replacement. And the stem cell was my option, and it's been wonderful.
So did you have any pain after the stem cell procedure?
I had none.
And how was the rehab of the stem cells compared to the rehab of the knee replacement?
2 weeks compared to 3 months.
Are you glad you got stem cells instead of the knee replacement?
I am so happy that I did that.
Awesome. Thank you so much for sharing your story with us, Linda.
Oh, you're welcome anytime.